Hi, Miss Schneider. I'm
Hi.
Kelly. I'm going to be your nurse today. Let me just use some hand sanitizer really quick. How are you feeling today?
I'm really not great. I feel really anxious and I'm really sweaty.
Oh, okay. Well, I'm sorry to hear about that, but we'll try to get you taken care of.
Okay.
Can you tell me your name and date of birth?
Yeah, it's Joan Schneider, October 12th, 1995.
Okay, just checking your wristband, and that is correct. Okay, and can you tell me where you are today?
I'm in the hospital.
All right, perfect. And what date is it?
It's the 12th, October 12th.
Yes. Oh, so it's your birthday.
Yeah.
Happy birthday.
Thank you. Don't want to be here.
And who's the president?
Joe Biden.
Okay, so she is AAO times 4. So I'm gonna check your pupils now. Okay. All right, pupils are equal, round, reactive to light, and they are about 4 millimeters. Okay, so do you have any hearing or sight issues?
Not that I know of.
All right, perfect. So now I'm going to feel your pulses
Okay.
and feel your heart rate. Okay, so her pulses are equal bilaterally and they are 2+, and her heart rate is 110. So I'm just going to take your blood pressure. Okay, so your blood pressure was 154/94, so definitely a little elevated. So we will let the doctor know about that.
Okay, cool.
All right. Now you're going to listen to your heart. All right, so S1 and S2 are both noted, and there's no extra heart sounds heard. So now I'm going to feel for your capillary refill. All right. And perfect, so that's less than 3 seconds. And I'm gonna go ahead and feel her pedal pulses, so I can pretend that she has her shoes off in this. All right, and those are also equal bilaterally and 2+. So her skin tone looks good, so now we're gonna move on to her lungs. So I'm just gonna feel each place of your lungs, so I need you to take deep breaths from me, okay?
Okay.
And while I'm here, I'm gonna go ahead and listen to your stomach too. Alright, so while I was feeling your pulses, I was also feeling for her respiratory rate, and that was a 26, so a little elevated. I heard no adventitious breath sounds, and your bowel sounds were hyperactive. So can you tell me, when was the last time you had a bowel movement?
Yesterday.
Alright, and so now I'm just going to feel her stomach, and just tell me if there's any pain. And now I'm going to do a deeper one. Alright, was there any pain? Alright, and there's no tenderness there. So now I'm just going to do an overall observation of her skin. So I'm looking at her skin, and she is a little diaphoretic and a little flushed. And so, but other than that, everything is appropriate. And then I'm just going to feel the temperature, and it is warm to touch. And so now I'm just going to feel her muscle grating. So can you push up against my hands. And can you push down? And then can you squeeze my fingers? And so all of her muscle strengths are 5+. I also need to check your O2 sat, so I'm gonna go ahead and do that. And that is 100%. You have no IV, so yeah. All right, hi Dr. Roberts. This is Kelly Fairbanks. I'm the nurse for Mrs. Jones Schneider. She is a 27-year-old female, and she came in today because she's complaining of a high heart rate and diaphoresis, and she just overall just feels very irritable and anxious. And she said that she has a hard time swallowing. So she told me that in the past she's lost about 9 pounds over the past month, and that she's just been feeling uneasy for a few months now. And so during my assessment, her blood pressure was 154/94, her heart rate was 110, her respiratory rate was 26, and her temperature was 38. And so my recommendation is that we draw labs for her thyroid levels and maybe do a CT of her thyroid gland. Thank you.